Hello, colleagues. My name is Olive Cookman with the Network for Improving Quality of Care for Maternal, Newborn and Child Health. Welcome to our webinar today. In this series, we've been hearing lessons learned by network countries in their efforts to build and institutionalize systems to sustain and scale up quality of care for maternal, newborn and child health. Today, we're going to hear of the progress across the 10 countries participating in the network since the network first began in 2017. So we will have the launch of our report, Evolution, Implementation and Progress. Over the past month, we've heard stories from Ghana, Bangladesh and Tanzania, building the understanding of what those findings today will also portray. So today has 3 parts. As we launch the report, we have a presentation on the findings and recommendations of the report. In the second part, we'll hear reflections from countries participating in the network and from partners that are supporting that implementation, listening to the lessons that have been learned, successes and challenges, and hearing the way forward. In part 3, which will be an interactive discussion with questions and answers. So we really look forward to your participation in that moment of the session. Please type your questions in the chat box. I must say that we have interpretation in English and French, so you just have to click on the globe on the bottom of your screen, and you'll be able to hear this interpretation today. So, il y a interprétation pour anglais et français aujourd'hui. Cliquez sur le globe d'interprétation sur le bas de l'écran Zoom. Okay, so merci beaucoup. Thank you. And I'm going to hand over to our speakers for part 1. We have Dr. Nuhu Yakub from the WHO Regional Office for Africa, who's going to kick us off, sharing background to the network. And then we'll hear from Berta Malici from the Department of MCA, the WHO headquarters, taking us through core findings. And Anshu Banerjee, Director of Department, Maternal, Newborn, Child and Adolescent Health and Aging, will set us out on the way forward. So without any further ado, over to you, Nuhu.
Thank you very much for the introduction, Olive. Welcome everybody, and thank you for joining us today. I'll be giving a background to the evolution of the network and the implementation approach. Next slide, please. So today, the report we have today documents the evolution of the network since its launch in 2017 and the progress to date. It also presents how the network was formed in 2017 and how it's been operationalized for implementation, cutting across aspects from policy change that have enhanced governance mechanisms for quality of care, partner and resource alignment, improvement of care processes, and catalyzing learning at country and global level. As you will see in just a moment from my co-presenters that will be shared today, within the report is an overview of the network country implementation progress, and it reflects on the successes and shortfalls to inform implementation at scale within the network and beyond. Finally, the report will identify the levers of change that enhance quality of care implementation. Next slide, please. So starting in 2016, with a series of consultations which were hosted by WHO and involving government representatives, other UN agencies and implementation funding partners, discussions was tailored around how do we build systems to deliver delivery of quality of care in an effective, scalable and sustainable way, in the process assisting countries to achieve their sustainable development goal targets. Key in this consultation was noting that most quality improvement efforts were project-based and did not survive initial funding, and also there appeared to be little evidence of scaling up and sustainability. So coming out of that, what was agreed was that more learning was needed to understand implementation, to sustain quality of care, and that efforts should be put into building a facilitated global learning network on quality of care. So in February 2017, 10 countries, Bangladesh, Cote d'Ivoire, Ethiopia, Ghana, India, Kenya, Malawi, Nigeria, Sierra Leone, Tanzania, and Uganda, together with WHO and a coalition of technical implementing partners who will also be hearing from today, established the network for improving quality of care for maternal, newborn, child health. And at the launch meeting in 2017 in Malawi, a vision was embraced around making sure that every pregnant woman, newborn, and infant receives quality care throughout pregnancy, childbirth, and the postnatal period with equity and dignity. And the 10 countries in addition are committed to a goal of reducing maternal and newborn deaths and stillbirths in the participating health facilities by 50% over 5 years and improving experience of care. Next slide, please. So this slide, we're trying to show in this slide is an overview of the critical activities implementation milestones that have happened between 2016 and 2020. And what it shows us, and starting from 2016, you can see starting with the development and launch of the standards for improving quality of care for maternal and newborn care. A series of activities have happened through the years, including development of other standards, whether it's for pediatric care or small and sick newborn care, but also, in addition, also establishment of systems and mechanisms to support implementation, learning, and accountability, so including such documents such as the measurement frameworks, also the community and stakeholder engagement module, but also a series of learning platforms built around the network website, podcasts, and series of webinars, which have been together bringing about showing how implementation, how countries can support implementation. Next slide, please. So to implement the vision described earlier and to achieve its targets, there are 4 strategic objectives of the network. Leadership, which is to build and strengthen national institutions and mechanisms for improving quality of care. Action, this is more work around how do we implement quality of care, particularly at point of care. Learning, and how do we create the ecosystem for learning, and also how do we finally accountability, how do we develop and strengthen and sustain mechanisms for accountability and quality of care. The implementation, overall, the implementation depends on leadership and commitment to quality by ministries of health, so it's led by ministries of health, and with heavy emphasis on the use of data for adaptation, learning, and coordinated and predictable technical support. Next slide, please. So here is the overall implementation approach for the network, and you see 3 distinct, I would say, levels. One is at the national level, the second is at district and facility level, and all underpinned by a system around measurements, monitoring, implementation, and impact, and also learning system. So what has happened is that together with the network countries and partners, this framework has been developed underpinned by principles of government leadership, multi-stakeholder partnership, and has been developed out of learning as implementation has happened over the last 4 years. And the key emphasis around this is the need for an overall strategic direction for quality health services with maternal and newborn child health as an entry point. And as you can see at the national level, it includes starting from, to do this, it includes building a broad stakeholder group and leading up to the adaptation of standards and agreements and indicators for monitoring. Below that is what we call the foundational requirements for quality of care, which is on-site learning, on-site support for healthcare workers, building the learning platform, strengthening the measurement systems, bringing the community into the discussion around quality of care, and overall emphasis around program management, which particularly at subnational level to facilitate implementation. I will now be handing over to my colleague, Dr. Bleta Malishi, who will now show some of the results that's come up from the last 4 years of implementation. Over to you, Bleta.
Thank you very much, Noho. Next slide, please, Olive. So in the next few minutes, I'd like to zoom in the progress so far along the milestones of the strategic objectives of the network. So the dashboard that you see summarizes the key milestones across the strategic objectives. In line with the strategic objectives, implementation at the country level began with a focus on leadership. And as you may see from the dashboard, under the leadership, much of the progress is on track, is marked in green. And as we move forward, you can see that it becomes a bit more orange, and red means that the actions are still lagging. Furthermore, activities were directed towards action, learning, and finally accountability. The learning and community engagement, which is part of the accountability agenda objective, were rolled out more recently and are still evolving. Hence, you can see that the colors as you go towards the bottom of the dashboard become a bit more reddish or white, meaning that information is not available. Along with successes in implementation of the action and learning, persistent gaps exist due to lack of critical mass of health managers and practitioners with the requisite skills in quality improvement, as well as needs for technical support and financial investments. And another set of challenges that defines the coloring in orange or reddish as we move towards that learning and accountability agenda are in relation to quality of care measurement and monitoring to demonstrate impact. And for most countries, this is mainly due to insufficient resources to support gaps in quality of care data and systems. Now, I'd like to go a bit more in depth in each of the strategic objectives and specific milestones. So next slide, please. And we'll start with leadership. Over the last 4 years, the network has been successful in keeping quality of care at the top of countries' national health agendas. This has been possible due to the commitment from country leadership and partners to the goals and strategic objectives of the network. The ability of the network to stay flexible and to respond to country needs has been fundamental to this success. As the dashboard shows, national quality of care policy and strategy and the related quality of care for MNCH roadmaps have successfully been developed or updated by all the network countries. This has led governments to allocate domestic resources to operationalize quality of care structures. And this is a massive success for all the network countries. By the end of 2020, all countries had set up quality of care management structures within the Ministry of Health. And that compared to February 2017, when only Bangladesh, Ethiopia, Tanzania, and Uganda had similar structures. Now, these structures are very important for sustaining the implementation of quality of care. That is one of the main goals of the network. At times, however, we have observed that tensions can rise between the new quality of care structures and existing MNCH programs. And that is due at times to absence of clarity on roles and responsibilities for quality of care action. However, that has not been a factor that has undermined implementation at scale. Also, more and sustained funding and resources are needed to scale up the implementation of quality of care and the related quality improvement capacities across all levels of the systems. So they don't sit or are located only at the national level, but they are fully rolled out at the subnational district facility down to service provision at community level. Under the leadership of the Ministry of Health, national quality of care technical working groups coordinate government and partners' quality of care efforts for MNCH. This aspect of coordination has been fundamental to the implementation of the network. The technical working groups were established to galvanize and harmonize technical support and investments around a common quality of care for MNCH approach and plan, to align resources and to build commitment towards sharing and disseminating emerging knowledge and learning. However, so while this coordination has been fundamental to the success, it has not always enabled partners to change their quality of care technical support objectives or plans based on their own funding cycles. Next slide, please. So in the next slide, I would like to give a short update and a bit more in depth in relation to the implementation of the milestones around the strategic objective of action. The unpacking of the action started with the adaptation and adoption of the WHO Maternal and Newborn Health Quality of Care Standards, which have been adopted by all the network countries. And then in relation to quality of care standards, the quality of care intervention packages, which are diverse across all countries and which reflect the implementation context and priorities. The majority of countries have identified learning districts where implementation, documentation, monitoring is taking place. As Nuhu described earlier, learning districts is a part of the learning model that the network is trying to promote, but also as a part of the mechanism for countries to learn how to adapt to their own pace of implementation to achieve their own quality of care results. Now, preparing the learning districts for implementation has included a number of activities, starting with orientation of the districts on the network approach, quality improvement methods, quality of care standards, intervention package, and so on. Often, these activities build on existing quality improvement or quality of care efforts that were ongoing at the country level. However, now, 4 years later, we can definitely say that it takes time to set up district and facility operations within existing resources, be those government resources or supported by partners. Additional efforts were needed to strengthen the coordination and governance structures to support quality of care planning and implementation at the subnational and district level. This level is crucial for the implementation of any quality of care activities, be those for maternal and child health or for any other health program. Implementation in learning districts in most countries gained momentum towards the end of 2018. However, we have to repeat that action in these learning districts has benefited from the use of existing quality improvement methods supported by coaches trained as part of previous quality improvement programs. Many of these coaches, though, they do work for specific quality of care projects, which has made it difficult to mobilize or engage them for longer term outside the scope of their own project settings. So, as the implementation has rolled out in many countries, many of them have had to identify and train new coaches to support learning districts. This is not a negative aspect because it talks to the scaling up and building capacities within the system. However, it is one of the aspects that has slowed down the implementation and scale up across new districts, or even capitalizing on gains within the existing learning districts. Scaling up of intervention packages is part of each network country vision. More time, resources, and technical support will be needed to transfer the requisite technical skills from the partners to the national and subnational structures responsible for supporting the implementation of these clinical and technical quality of care packages. Next slide, please. So as we move from action towards learning and accountability, you will see from the dashboard that the colors start to become more orange, red, or empty, meaning the information is not available. And that is because these two agendas are intertwined, are still new, are being rolled out, but at the same time are the most difficult agendas in terms of the implementation for sustainability and scaling up. Progress is being made across countries in establishing quality improvement learning systems at the local levels, and the quality improvement data is being used by some countries for learning purposes. However, today, only Ethiopia and Ghana have managed to establish functioning district learning networks, meaning networks that allow practitioners, managers to exchange information with each other and to learn from each other from both successes and failures. The institutionalization of learning systems at the district and national levels depends on addressing the latent quality culture and the widespread absence of quality improvement capabilities at the management and frontline levels. And those are two gaps that we'll need to struggle with to address as in the years to come. On the learning platforms and systems, 3 countries, India, Bangladesh, and Uganda, have established partnership with national research institutions to support the development and implementation of national learning platforms, including the facilitation of exchange among the practitioners at the learning districts, decision makers, academics, and others. Why is it important to get this aspect of learning addressed at this time? It is because the documentation is important, but in addition to the documentation, the evaluation of the good practices that are worth scaling up need to go through the hands of our academics and supporting institutions, so the policymakers know what is worth supporting as well as scaling up in terms of good practices at the country level. Now, in the absence of these types of partnerships, other countries are using social media and digital technology to bring together practitioners. And that is a way of sharing experiences at the more micro level, at the subnational and district level. At the macro level or at national level, annual national quality forums have also provided countries with an effective mechanisms for sharing learning. And this year, all the network countries are engaging in their national forums, addressing, trying to document and share their lessons across from their implementation. Now, despite these examples, countries are yet to translate the documentation of quality of care learning into policy dialogue for scaling up and successful packages of interventions, or to adapt the strategies and systems to address implementation gaps. And this is because coordination and alignment of the work of stakeholders responsible for evidence generation and policy making and the day-to-day implementation of programs is yet to be institutionalized and funded. So linking that academic world with the policy making, with the management and implementation, and the frontline provider is still something that needs to be developed across the countries. Now, another important aspect of accountability is the community engagement. By December 2020, Ethiopia, Ghana, Malawi, and Uganda have established a mechanism for systematic integration of community participation and accountability for quality of care. So while all countries have some form or different forms of community engagement mechanisms, in those 4 countries, we see a systematic involvement of communities in quality of care. So despite some good examples, for example, in Ghana, we have the example of using the use of community scorecards to monitor health service provision. We have the model of hospital ombudsman in Malawi. There is a model of community dialogues to inform development or joint actions in Uganda. Still, we believe that more work is needed to address the accountability aspect from a community integration into the routine system. Now, as we move forward, a very important aspect and milestone that ties together all the 4 strategic objectives is that in relation to data, measurement, and monitoring. So, and for those who are not familiar with the framework, the monitoring sits between the strategic objectives of learning and accountability. So at the very beginning, the onset of the network, all countries of the network agreed to monitor a set of common quality of care MNCH indicators that the national system should have been able to report upon. Progress in documenting and sharing this data varies across countries, and that reflects the capacity and constraints of the information system. However, for today, while we do have the information, but we don't have the time to share all the information from all countries, we only wanted to give an example that from the Mamoni Maternal and Newborn Care strengthening projects that our colleagues in IHI Save the Children are implementing in Bangladesh. And you can see how the progress in the implementation of the package of interventions, what they call bundles in their context, is progressing, and they are using a number of the indicators. Next slide, please. As we're still in the argument around the indicators and measurement, we would like to share a few findings that we have from the implementation so far. So first of all, countries' capacities to collect data varies across indicators, and not all relevant quality of care indicators are integrated in the routine information system. So those are those common indicators that all countries agreed upon to monitor at the beginning of the network, and which normally should be part of our system. The network secretariat, so as a mitigation measure, deployed a complementary data system to facilitate the collection and use of common indicators. Otherwise, we'll not be able even to show progress or any type of impact in short, mid, or even longer term. So this type of complementary data system is useful, or at least is proving to be useful stopgap to help countries to measure maternal newborn quality of care indicators in short term, while investing in the long-term strengthening of the health information systems. Health information systems in many countries continue to face structural and operational deficiencies, which affects the data quality, analysis, and use to drive improvement. And then, although it takes a long time, countries are beginning to share common indicator data for global and national learning. And this is very important as we move now towards the last 16 or 18 months of implementation, and then we need to demonstrate what is the impact of the network. District and facilities do need capacity strengthening on data, quality improvement, data management, analysis, and use. Without this capacity, it will be very difficult for all of us to demonstrate any impact. And finally, as we're moving more towards the impact and thinking about the impact evaluations are needed to identify packages of interventions that have or maybe not have led to a significant impact for the purpose of scale up and sustainability. So all these type of questions, they do depend on data and data quality. Therefore, this is another big agenda that we as a network need to pursue as we continue with implementation. And at this point, I'd like to hand over to Dr. Anshu Banerjee, Director of Department of Maternal, Newborn, Child, Adolescent Health and Aging in WHO Geneva, to share with us the emerging lessons from the network. Over to you, Anshu.
Thank you very much, Berta. And so what is the progress so far? In line with the strategic objectives, implementation at the country level began with the focus on leadership. You'll see in the dashboard under leadership, much of the progress is on track in green or in progress, orange. And activities were then directed towards action. The learning agenda was rolled out more recently and is still evolving. Countries and partners are now initiating their own work around community engagement for quality of care. So along with the successes, however, there are still some persistent challenges, notably those related to quality of care measurement and monitoring to demonstrate impact. For most countries, this is mainly due to the insufficient resources to support gaps in quality of care data and data systems, lack of critical mass of health managers and practitioners with the requisite skills in quality improvement methods, and continuous dependency on countries on partners' technical assistance and final investments. So if we look at what the emerging lessons are from leadership, the first one is it takes a whole system to improve quality of care. And the quality of care agenda has advanced in countries that developed national quality policy and strategies, that started to set up dedicated quality improvement structures across all the levels of the health system, and that established accountability mechanisms. Government leadership and long-term commitment is a prerequisite for success, and this leadership is critical for aligning partners and investments, allocating domestic resources in support of quality of care structures and systems, and strengthening accountability for quality of care implementation. And thirdly, we have the fact that quality of care requires dedicated and sustained investment and partnership, and the quality of care agenda does not exist in isolation. It must be integrated with other ongoing health system strengthening efforts and supported by predictable and continuous technical assistance. What have we learned from action? Next slide. Health systems operate in different contexts with which impact the pace of quality of care development, adaptation, and implementation. Countries progress better when their quality of care structures and strategy are anchored in their existing health systems architecture and reflect their actual capacity to reach targets. Improving maternal and newborn health quality at the point of care will only bring about small-scale changes if systematic or systems and resource gaps are not addressed. Building quality improvement capabilities is necessary for sustaining the provision of quality of care, and quality improvement capabilities in many countries' health systems are still limited, and quality improvement capacity building requires time and investment. Pre-service education should include a focus on building the quality improvement knowledge of health workers, and at the same time, health services management must change to embrace a quality of care culture and encourage quality improvement as a method of work across all levels. Lessons emerging from learning. The first one is designing, implementing, and monitoring a comprehensive and adaptable quality of care program at the district or at regional levels is critical. So designing quality of care for maternal and newborn health programs at district levels must include involvement of communities and stakeholders from the very beginning. Even the best program designs will not show impact if implemented poorly, not monitored, or are neither context sensitive nor adaptable. The second lesson is that documenting and sharing lessons from quality of care initiatives can help build more effective programs, and it requires trust. Learning from quality of care initiatives can be transferable to other quality of care programs when they document and respond to why improvement ideas worked or not. Countries must be willing to share their data and lessons so other countries can apply the learning to their own implementation context. Building trust among members of the network is critical for the sharing of lessons within and between countries. And a facilitated network offers a valid for rapid South-South learning and accelerated progress in quality of care. The network provides a facilitated platform on collaboration for countries and partners to work together under a common vision, co-design, and engage in joint implementation. The network has provided a trusted and safe space where quality of care country leadership and stakeholders can meet, can partner, and can exchange ideas and solutions to implement challenges. Finally, emerging lessons from accountability. Engaging communities and stakeholders in designing and implementing quality of care for maternal and newborn health programs paves the way to progress and ensures accountability for quality of care. This engagement is critical to help identify gaps, prioritize concerns, and monitor performance. When community engagement mechanisms are in place, they provide a powerful avenue to ensure accountability for results. Investing early and intentionally in the development and strengthening of data systems for quality of care is also essential, and opportunities should be leveraged to integrate maternal newborn health quality of care measurement efforts with broader initiatives to improve health information systems. Integrating relevant quality of care indicators in routine improve health information systems also to improve health information systems also strengthens accountability for quality of care. And finally, demonstrating impact of quality improvement activities takes time. These interventions implemented at the health facility level can show tangible results in a short time. However, if an impact assessment is conducted too early in the implementation process, demonstrating the impact of quality improvement initiatives implemented in multiple health facilities with varying focus, intensity, and timing will likely be limited. So how do we move forward? And we're going to look at what would be next steps for network countries and what would be next steps for partners. For network countries, moving forward, commitment and engagement of governments and partners will be required to sustain the gains made and to strengthen the institutionalization of quality of care for maternal, newborn, and child health. Network countries will have to align strategic investments, such as from the Global Financing Facility or the Global Fund and other funding mechanisms. And they have to align this to governments and government funding and partner funding in order to ensure that there is a continuation to work to increase domestic resources for improving quality of care, to strengthen health systems' foundations for quality of care. Updating the National Health Information System to reflect quality of care metrics for maternal and newborn child health and other programs will also be critical, as this will be strengthening and scaling up workforce competencies and capacities to address quality of care. Network countries and partners will also have to ensure systematic involvement of communities to improve quality of care and strengthen its accountability mechanisms. The involvement of academic institutions will be critical to support the development and implementation of a national learning platform for quality of care. Strengthening the network partnership to reflect changes in country priorities and context will be needed to maintain the relevance and effectiveness of the network and to support scaling up the implementation of quality of care activities within and beyond the network. Lastly, network countries will need to strengthen subnational capacities for quality of care and to scale up within countries and across programs. Experiences from implementation in the network countries is informing the development of fresh normative guidance on how to implement quality of care programs across the network partnership. The lessons learned from this experience can be used to inform the scaling up of quality of care activities for maternal and newborn child health within and also beyond the network countries. And then what can the partners do? First of all, WHO and partners must continue to provide support for capacity building for quality of care with a focus on subnational level as a means for sustainability and scale up. We should prioritize and align investments aiming to support national priorities on quality of care for maternal and newborn child health, including strengthening health information systems. We should evolve the normative guidance to reflect the learning emerging from the network. We should look at how to support countries to conduct implementation research and impact evaluation to assess effectiveness of the implementation of quality of care maternal and newborn health packages to inform scaling up. And lastly, we should use the lessons from the quality of care network implementation to inform coordination and delivery of technical support to countries that reflect leadership, priorities, and partner alignment around the national strategy and plan. And we should expand the learning network beyond the network countries. Thank you very much, and back to you, Bertha.
Thank you very much, Anshu. In the program, we have a session on questions and answers after the reflections from countries themselves and the partners. However, I just want to address maybe one question to you, Anshu, and one to Nuhu. And the first question to you, Anshu, is about other countries. Can other countries join the network? There are at least 3 questions in the chat that are asking the similar thing. Can the countries join the network?
Sure, Bertha. And of course, other countries can join the network. We have already expanded the network, and we initially started with 10 countries. I think an 11th country expressed interest. Other countries can join. We would like to ensure that the basics would be in place at country level so that there is support at the country level from partners to support the ministries of health in taking the quality of care standards forward, and really make sure that there is support also to do this at the subnational, at the district level. So we would love to expand the network, and that is one of the objectives, let's say, of this session today as well.
Thank you, Anshu. And you almost answered the second question that I was going to ask Nuhu. Nuhu, people would like to know, or if you can elaborate, what were the initial selection criteria for the network countries?
Thank you, Bless. So the initial selection criteria for the network countries were, one, were looking at that time countries which have had very high or relatively high in terms of contribution to overall global burden of maternal, newborn, and child mortality. And also countries which were also interested and prioritized at that time that quality of care was a significant and important part of their approach to reducing this burden.
Yeah. Thank you very much, Nuhu. And I'll add that countries that already had partner presence and had a high commitment to quality of care, that had introduced quality of care as part of their national strategic objectives for achieving SDGs. So those were the key criteria around this initial selection. So thank you very much, Anshu. Thank you, Nuhu. I would like now to shift to the second part of our agenda for today. And that we would like to invite, first of all, the implementers, the Ministry of Health and partners who are supporting the implementation directly at the country level, to share with us some reflections on their experience so far, and to let us know some of their initial thinking. And as part of this reflection, I would first like to invite Dr. Malingzio Mbewe. He's the Acting Director, Quality Management Department in the Ministry of Health and Population in Malawi. Over to you, Dr. Malingzio Mbewe.
Thank you so much, Bleta. I'm Dr. Malingzio Mbewe, Acting Director in the Ministry of Health, Malawi. I want to share our experience from the Malawi perspective And my focus mainly will be on the role the Minister of Health leadership played in the establishment of the quality of care network focusing on maternal and newborn health in the country. As highlighted by the previous presenters, Malawi is one of the members of the network on quality of care, and Malawi indeed leadership played a very big role in championing issues of quality. And basically this followed a review of our national health sector strategic plan, which reviewed that quality issues are there in terms of provision of care. And this basically was highlighted from the number of deliveries which we are having at facility level at 90%, while we are still having high maternal mortality rate. So an establishment of a quality management department was done. And this time around, it was also the time the network was being established and launched. And the minister through the department worked on leading in terms of development of this quality of care network. And we, as a ministry, we focused on, initially on developing policy documents. So we have like a quality management policy in place, quality management strategy in place, and we, as highlighted, we also adapted the quality of care standards. And when we were adapting the quality of care standards, we also included developing on the standards on the pediatric care as well. And we also developed a roadmap to guide the implementation of quality of care network in the country, as well as assessment tools. On the accountability, we also included establishment of the hospital ombudsman as a social accountability platform for clients. We have been working with our partners through a partner coordination forum and also a quality management technical working group, which we have, and we share various progresses as far as quality of care is concerned. And with support from partners and coordination, we had to build the capacity of the implementing structures, the quality improvement support teams, the work improvement support teams, and in general, the health workers. And we also have been leading in terms of conducting like assessments on how orientation and conducting assessments on the quality of care standards in our training sites, as well as following performance of our facilities. And some of the lessons learned, which we have noted as we are implementing the quality of care, are focusing on MNH, is that during the baseline assessment, we noticed that there are a lot of gaps which need to be addressed, more especially systemic gaps from the facilities where assessments were done. And indeed, these also poses some challenges in terms of how facilities should be able to prioritize. And it made us to also to say that we need more investments in terms of in the systems to make sure we are able to implement quality of care initiatives. There were also data issues, more especially capturing of the data. We have different sources where, in terms of capturing data, the DHIS tool, we have got the MP, maternal perinatal data surveillance response system. So we still have got some challenges in terms of information talking to each other through these data systems. And still under the data, actually the actual analysis of QI data using QI methods as well as use is also what we are also an issue which I think we needed to also focus more as a country. The other area which we noted is on also conceptualization of the QI processes as well as tools by health workers. because for quality, if you want to implement a quality initiative, there are systematic way or methods which you need to follow, as well as the tools. So this is also an area which we are still seeing that our staff are still having challenges in grasping some of the tools in terms of use as they're implementing various QI initiatives. We also cannot forget issues to do with the COVID-19 disruptions, as we were implementing our quality of care initiatives. And what we are looking forward in terms of way forward, I think there's need, because we still have got capacity gaps in terms of health workers trained in the country, because we only focused much on the facilities which are learning sites. So we really need to integrate the QI training model into the pre-service training, so that we are able to cover more and train more people right away from the pre-service training. The other area which we also need to involve more is the involvement of other departments and programs within the ministry or outside the ministry, to make sure that we are taking quality in a holistic approach. As you are aware that quality is cross-cutting, so we really need to take that holistic, involving more of our other departments within the ministry. And also, since MNH has been taken as a learning platform, so we are looking at now quality in the country is being taken as a maternal and newborn health program. But I think we needed to be able to spread quality into other health service areas or system areas other than the maternal and newborn health, considering that quality is cross-cutting and it needs to be integrated if we are to sustain issues of quality. And we also need to invest more in building capacity on how to analyze data using QI methods as well as utilization. So basically, as a reflection for Malawi, this is what I wanted to share with everyone. Thank you. Over to you, Malik.
Thank you very much, Dr. Mbewe. And without losing much time, I'll hand it over to Dr. Desalenge Bekele Taye. Dr. Bekele is the acting coordinator of Health Services Quality Improvement Team in the Ministry of Health, Ethiopia. So over to you, Dr. Bekele.
Thank you so much, Blerta. I will have an exactly 3-minute speech. Don't worry, I will not waste your time. So for the last 2 decades, Ethiopia has been known for its remarkable progress in the attainment of positive health outcomes and overall population health. Especially the maternal, neonatal, and child health has been significantly improving. On the top of this, for the last 3 years, the implementation of MNHQD in the network of 14 districts has shown a promising result. Previously, the quality improvement efforts in Ethiopia were mainly undertaken in larger hospitals. The MNHQD initiative, however, helped us to take the quality improvement concepts and practice to the districts, to primary hospitals and health centers, where the majority of population gets essential health services, and real exercise of quality improvement is obviously expected to happen. Using this experience, the national healthcare quality and safety strategy is being framed in such a way that it institutionalizes district level improvement and learning as mainstay to improving the care outcome and ultimately population health. The MNHQD measurement has also opened our eyes to holistically measuring and monitoring of quality of care delivery beyond the measuring of health outcomes. Therefore, the measuring the care receiver's experience of care delivery should be given a priority and monitored accordingly. So people's experience of a given care is a critical component for the reduction of morbidity and mortality, as this is a critical factor in seeking care, retention, recommendation, and trust. Another lesson that we learned is a collaborative execution of plan, bringing different partners working together for a common goal is another success. This informs us that rather than taking fragmented projects here and there, and even within the same facility, the implementation of a bit larger schemes of projects, programs by aligning available resources and stakeholders is more efficient and more sustainable. So the coordination, monitoring, and technical input, even provided by a team of groups, we call it Technical Working Group for MNH, is exemplary, and this has helped the ministry very much. Finally, the ministry is preparing to take the scale up of QED initiative to the areas with high morbidity and mortality burden, and to the other areas, to other disease areas, similarly tailored initiatives will be executed for the coming 4 years of the new national quality and safety strategy. So this is our reflection from Ethiopian side. Thank you very much. Back to you, Bulerta.
Thank you very much, Dr. Bekele. And I would like now to invite Minara Chowdhury. She's Senior Advisor, Quality Improvement, USAID Mamoni, MNCNP, and Country Director for Bangladesh, for IHI Bangladesh. And the slide with the data that I showed comes from the project that Minara and her team are implementing and facilitating in Bangladesh. Minara, over to you.
Thank you, Blerta. So the reflections that we'd like to share for Bangladesh, who has been a member of the WHO QED network since the beginning, and belonging to the network has really provided us with a guideline and with a structure to improve MNH care. Implementing quality of care initiatives aren't really simple. They're complex in nature and they do take time. And there are no shortcuts. And that's something that we've really learned here. And involving the Ministry of Health as a project is really important, and ensuring that they are with us every step of the way is also really critical. So as a member of the consortium of USAID's Mamoni MNCSB project, IHI worked on developing an intervention package, which are called clinical and operational bundles. We have around 19 bundles, which are being implemented currently across 86 facilities. And we've learned a lot through those implementations in terms of the actual process of implementation, but more importantly, the design as well, and then how to really look at the human factors of change. So really QI activities have been something that's an addition to people's jobs. And that's something that we've really worked on trying to address. So the clinical bundles or the intervention packages that we have are actually addressing the processes to improve either antenatal care, postnatal care, or whether it's correct use of partograph. So they're actually addressing the clinical and operational processes, both from provision of care and experience of care. And once the providers realize that they're actually improving the clinical processes and outcomes for mothers and newborns, and quality improvement is the process through which they do that, all of a sudden that becomes more easier and more palatable. And that's really powerful, and that's what's going to help sustainability. Leadership engagement and coaching goes without saying, and ensuring that the leaders are really aware of what's happening, what's been demonstrated, what are those improvements, and how are the improvements actually taking place is really important. We encourage leadership walkarounds, and we've also instituted meetings whereby they're actually discussing data, and having that open atmosphere is really important. But there are, of course, challenges of collecting data. That's a real challenge here in Bangladesh. A lot of the systems that we have can't collect the data we need to demonstrate improvements. So there tend to be manual data systems that support and complement the main data systems. And that does take time. But over a period of time, that actually becomes more and more embedded within the system. And we've really tried to use the government registers. So we're not introducing brand new data collection systems, but as much as possible to try and use the government systems to do that. So I think our learnings can be summarized that quality is not something that we need to be frightened of. We also need to give it time. We mustn't be too quick in judging that interventions have worked or not worked. The power of networking and the power of learning together is really important. And we've also learned that that's really what's helped us in the success that we've had in our 86 facilities. So improving quality of care takes us beyond the normal practice. We're not challenging just clinical practice or how to do things better. We're actually challenging human behavior. And that's something we really need to focus on as well. So really, in summary, we need to have an enabling environment, which is really through the Ministry of Health and Family Welfare, which we have here in Bangladesh. We need to have intervention packages that make sense to the providers, not just to us, but to the providers. We need to be able to build capability, engage leadership, and also really demonstrate how we can make improvements to care. Thank you, Bleta. Thank you.
Thank you very much, Minara. And after these 3 country reflections from those who are implementing day-to-day quality of care, I'd like now to shift to our partners who are supporting that implementation. And I'd like to start with Dr. Tedbabe Haile Gabriel, who is a senior advisor on health, maternal and newborn child health in UNICEF headquarters. And UNICEF is one of our critical partners in implementation and supporting the implementation at the country level. Tedbabe, over to you.
Thank you, Blerta, and thank you, Dr. Anshu, Blerta, Nuhu, for sharing this remarkable progress of this evolution of this network for improving quality of care for maternal and newborn child health. This report is really informative and provides a pertinent insight on the value of effective coordination and collaboration between UNICEF, WHO, and other partners. I want to extend a very warm greetings to you all on behalf of UNICEF, and UNICEF is proud to be part of this journey since the inception of the network. From piloting the maternal newborn health quality of care standard in Bangladesh, Ghana, Tanzania in few health facilities to scale up in more countries, now in 5 of the network countries and in more health facilities. And we truly appreciate this collaboration with government and development partners. I want to reflect on 3 lessons overall from the report and specifically also from UNICEF experience in district level implementation in Bangladesh, Ghana, and Tanzania. Those of you who attended the last 3 webinars will recall how these countries initiated starting and implementing and documenting a district level implementation of these standards. So my first point is addressing the quality gap requires attention from all stakeholders. I think it is very clear now for everyone that quality of care is critical to operationalize the ambitious health-related SDG targets and the universal health coverage agenda. Improvements in coverage of life-saving intervention for maternal, newborn, child health have not consistently translated into reduction in mortality from preventable conditions, as we have seen many research have shown. Currently, poor quality, not poor access, is a major cause of preventable deaths. So what we have seen is implementing quality of care standard in health facilities, at that micro level is necessary to improve health outcomes. And quality improvement interventions, when appropriately implemented, will help save lives. We have seen a significant reduction in perinatal mortality in facilities implementing the standards. And they are overdue and necessary to strengthen also quality of primary health care and achieve sustainable development targets and beyond. Quality of care also should be an entry point for broader health system improvement. And as Minara mentioned, coaching and mentorship is critical. When it is fully integrated in national strategy, it will allow the availability of expertise to support care at all levels. Gaps in skilled human resource are a threat, as we know, to sustain progress. What we have seen also in this line is gains in quality improvement, whether it is, at facility level or, network of facilities, is not an end in itself, but it should be as a platform to achieve even more improvement in the other areas as well, because substantial challenges still remain to improve quality of care for mothers and newborns and children. My second point is, as clearly outlined in the report and as many of the experiences have shown us, sustaining the result will require a system-wide change and significant technical and financial support to many of the settings in where health systems are weak and mortality and morbidity burdens are high. So addressing the need for more effective organizational structures, as many of the researchers have shown, they are the bedrock for system resilience. And this includes, redesigning of the care process. Many of the participating health facilities have shown that there is a need to redesign the system, the care flow, strengthening and using the information technology, managing knowledge and skill, coordinating care across patient condition, service and setting, developing effective team, and implementing performance outcome measurement for improvement and accountability have been really key. These remain, although the setting could vary and many of variables could change, these have been shown to be the bedrock and I would say the constant that requires a significant investment and attention. In this line, strong leadership promotes inclusivity of professional association, public part that enhances public-private partnership at all level has been key to success. Translating policy and guideline from the policy at the macro level to the micro level at the facility level has really helped to synergize action for greater stakeholder buy-in. Scaling up of implementation of quality of care activities within the network and expanding its approach to additional countries and regions definitely will require a significant technical assistance and financial support. And as we have seen, takes time and also should not be expected, to deliver, to see change immediately, because what we have seen is actually when you improve the data system, the changes may not appear positive initially, because you will identify more problems, you will identify more gaps. So in this line, the global partners, we need to engage, to continue our engagement in the development and adaptation of these standards to all levels of care, including in operationalization of the respectful care for maternal newborn child health, and also the development of the standard of care for community-based service delivery. My third and last point is the need for more investment for improving quality of care. In this line, I would like to point out, two, from my perspective, are really critical. One is investment in health facility infrastructure, and second is the human resource. This is by no means not undermining the other building blocks. But I believe, this, especially in line with the growing population in Africa and Asia, needs to be really given due attention. And along with this, strengthening the health information system for action and accountability with sustainable and predictable financing are key. So continuing engagement with government and partners are required to sustain the gains and also to institutionalize and scale up learning district expertise and care. As we all know, and the pandemic is our new reality, before it hit us and also after it is over, the solutions to address quality of maternal and newborn child health remains the same. However, with the pandemic, the urgency to act is now even greater. So as we strive to protect, preserve, and track much needed resources to provide quality of care for every woman, every newborn, every child, every adolescent, for the remaining priorities, such as the equity aspect of quality of care provision, community engagement in quality of care decision-making, provision of quality of care in conflict-affected and vulnerable setting, engaging the private sector to deliver quality, and the use of digital technology and innovation as a means for enhancing quality of service will require attention and action. And you can count on UNICEF on this journey, and thank you. Back to you, Blerta.
Thank you very much, Dr. I really appreciate it. And now I'd like to hand it over to Dr. Lily Kak, Senior Advisor in Newborn Health USAID. For all those who are still attending, I would like to say that Lily is one of the funders, even one of the people who had envisaged the development of network before it even existed. So Lily, we are very privileged to have you now. I would say 5.5 years since you started to brainstorm on this network. So over to you.
Yeah, thank you so much, Blerta. It's such a pleasure to be here. Thank you for inviting me to reflect on the progress of the Quality of Care Network. You know, as Blerta said, I've had the privilege of being involved with the network since it was first conceptualized about 5 years ago, and have been encouraged as I watched it evolve and get traction in countries. As I reflect back on the past 4 years, there are 3 driving factors that stand out in my mind. The first driving factor has been the leadership of countries in prioritizing quality of care and really taking action at the national level. And quarterly country presentations and an active webinar series have helped us learn of various country experiences from the 10 member countries of the network. The second driving factor is WHO's leadership in initiating a quality of care network to catalyze action at the country level, developing quality standards for MNCH that gave equal importance to the provision of services and to the experience of care, emphasizing the importance of respectful, nurturing, and responsive care for mothers, newborns, and children, and developing common indicators to monitor quality and articulating a bold goal of reducing facility-based mortality by 50%. And the third driving factor has been the international partners' support of country efforts to improve quality of care. As countries prioritize quality of care, USAID and several other partners were right behind these efforts, both at the global and country level. We have prioritized our investments to support national priorities on quality of care. I was pleased to hear the WHO presentation and how they have identified several areas of focus going forward, including health systems strengthening and community involvement. In addition, I would like to see increased focus in improving quality of care in the private sector, and also in fragile settings, and ensuring that the same standards are applied in both public and private sectors in all settings. I would also like to see the dashboard expanded to include country progress on the common indicators. As you saw the dashboard presented earlier, it's a dashboard of milestones. But I would really like to see that expanded to include outcome indicators. WHO is to be commended for developing a set of common indicators and supporting their rollout. And now we need to support the network to increase its efforts to strengthen routine health information systems that incorporate these indicators. And you saw the last slide that Anshu Banerjee presented had a series of points, recommendations for partners and donors to invest in. I'm pleased to say that USAID has been supporting all those points over the past 4 years since the network was established. And we will look at it and intensify our efforts. As Ted Bob said, you can count on USAID for providing continued support for quality of care. Thank you.
Thank you very much, Lily. It's really encouraging to hear that 5 years later, you're still enthusiastic and positive about quality of care and the ways of working around the network. And finally, I'd like to invite Dr. Shams Seed. He's the head of quality of care unit in WHO headquarters. I would say everything about the network is about health system strengthening and quality of care in health systems. So Shams would really benefit from your views around this implementation way forward.
Thank you very much, Blerta, and really a privilege to be with you all today, and a real privilege to have been with you on this journey over the years from inception. So it's been fascinating to hear from all of the different perspectives from colleagues, and I just had three to add, and one of them focusing in on success, one of them focusing in on a challenge, and one of them focusing in on what I consider as a huge opportunity for the future. So we've heard from colleagues about the critical importance of a system-wide approach to quality. And I really consider the work that the network has done has been a great success with countries in driving some of that system-wide approach to quality. And the fact that each of the network countries has developed a national strategic direction on quality is really something to be commended. And I think one of the things that we should remember is that a national strategic direction on quality is empty unless it is accompanied by action at the district and facility level. And that's particularly why the description from our colleague from Malawi, Ethiopia, and Bangladesh really brings things to life. And this will be, for us, I believe, a success to build on. In terms of a challenge, and we've heard from colleagues on the persistent challenge that we face today in the COVID-19 pandemic context. And one of the challenges that I feel we will need to consider in a deeper way is equity. And as one of the domains of quality and a guiding principle of the network, this is something that will require our focused attention. And it is a challenge to understand and act upon the disproportionate burden that is placed on women and children. And the COVID-19 pandemic has really once more shown that there are persistent and structural inequalities that we need to tackle. And this is where the challenge is placed on the network as it moves forward. So as countries pursue the next phases, the data that the report calls for will need to contain a focused attention on equity within these conversations. The focus on opportunities, colleagues, I wanted to highlight is that the report outlines that the global quality agenda has had some really important advances since the launch of the network. And this has been one of the beauties of the network, is that we have seen co-development of various products during the existence of the network. At 2018, and I think many of you will know the seminal documentation that came through in 2018. And of course, we can build on that foundation. And while we need to recognize that foundation, a particularly important opportunity is there now with the release of the WHO and UNICEF operational framework for primary healthcare, which outlines 4 strategic and 10 operational levers. And importantly, one of those levers is systems to improve the quality of care. So this opportunity comes very rarely, because as countries put this into practice in the reform of their health systems, we have a huge opportunity to feed in the experience and the wisdom and the interesting things that have worked and the things that haven't worked from the network, and align our efforts for maximizing impact for mothers and newborns. Just a warm congratulations to all of the colleagues that have worked so hard to get to this point, and particularly to all of the country teams. Blerta, back to you.
Thank you very much, Shams. Thank you, really appreciate it. And now with this full vision of the implementation from a country level, from the partners who are supporting the implementation, from those who had visualized this network even before it started, and now knowing where we are in this bigger quality of care agenda, I'd like to shift to the third part of our session today, which is on questions and answers. And the chat has been buzzing with questions and questions. A lot of them, some of them are being addressed as we speak. However, I think it will be of interest to everybody to hear some of the answers. So a group of questions is, I'll start with the measurement and monitoring because it has quite a few questions around that. We have the benefit of having our colleague, Dr. Moise Muzigaba, who is connected with us, and he is co-leading the working group on quality of care measurement for maternal, newborn, and child health, and the measurement around the network. So Moise, if you hear me, we have a number of questions in relation to measurement. One of them is what are the indicators? Second, which countries are reporting on these indicators? Are we reporting, or is this information available? Third question, more specific, what are some of the measurements around respectful care, and how are they being reflected in the overall measurement framework? And I'll stop here and I can come back with a second batch of questions.
Thanks so much, Blairta, and thanks, colleagues, for the questions that you've put in the chat box. I think I had addressed a few of them in the chat box, but maybe just to come back to those, we've got a host of common indicators that have been prioritized for monitoring quality of care for maternal and newborn health. And these are largely outcome and process related indicators. We have indicators such as the pre-discharge maternal deaths. These are disaggregated by cause of death. We have neonatal mortality rate. We have institutional stillbirths. We have pre-discharge neonatal mortality rate. We have a few on WASH. We have some on experience of care. And I've copied in the chat box the link where you can find a list of these indicators and how they've been defined, the metadata around these. And as the presenters highlighted in the network, there's been variation across countries as to countries' abilities to measure, monitor, and report on these indicators, mostly because of the health information system maturity that varies across countries. And that brings me to a question that I think Fatima, our colleague from UNICEF, asked as to which countries are reporting on these indicators in the network. So I would say that, first of all, to highlight that there are two types of indicators that have really been problematic in terms of measurement and reporting. One is the experience of care indicators, because these never existed in most countries in health information systems. So they required more intense, resource-intensive efforts to ensure that the data is collected. And also, secondly, the WASH-related indicators have also been a problem to collect and report. But for the other indicators, we've seen countries such as Nigeria, Bangladesh, Ghana, Malawi, Uganda, and Sierra Leone being able to collect data for some of the indicators that already existed in their health information system. And this has been quite helpful because we've been able to see how the countries have progressed, specifically from the learning sites that have been selected on specific indicators for which data elements were available in the health information system. And I would say that these indicators are relatively easy to collect because they are routinely collected. So we were lucky to map these to existing indicators in, for example, DHIS2, and therefore the health informatics system at country level was able to collect these. And then the other question was around the experience of care. Of course, I did highlight this briefly. These have been rather difficult to collect in that they required the assignment of a person at health facility level or a district level who does the data collection, because I mean, most of them are supposed to be collected using exit interviews. And with the available resources, it hasn't been easy for countries to report on these. But we have countries such as Malawi that have already put in place a mechanism that will facilitate the collection of these indicators. They are working with the hospital ombudsman, who sits within a health facility and is responsible for issues related to the provision of health services, including the collection of these indicators and also accountability at hospital level. In Ghana, they've managed to put together an online system that has been used previously to collect data for the experience of care indicators. But again, this requires that somebody actually visits the health facility and conducts the exit interviews with women that are being seen at that health facility. So maybe I'll stop there. And I don't know if later there are any additional questions I could take on. I did see one question related to whether the innovations that are being generated from the network are being shared. I did highlight that we are completing, actually, we had a meeting last week to conclude the process of developing an online platform that's supposed to host the innovations in QI that countries have attempted. We would like to make available those that have been successful and unsuccessful on this platform. And we hope that over the next couple of months, it will be available for people to look at what countries have done. And it's going to be a platform that's open to the entire world for anyone who is interested. And the innovations that are included on the platform are not only limited to the what has been done in the quality of care network. We plan in future to also tap into the knowledge base that has been generated from other countries to ensure that there's representation across countries. Back to you. Thanks, Berta.
Thank you very much, Moise. Now I have a question to Anshu. Anshu, there are a number of questions in relation to expanding the focus to include pediatric care or child health. Would you please comment to that question? Thank you.
Thank you. And in fact, there is a lot of work going on standards and on quality of care for pediatric care. So the overall framework is an overarching framework. And so the component of pediatric care falls also under that, let's say, is very much aligned to the overarching framework. And countries have also already moved into that within the network. So 2 years ago, when we had the meeting of the network in Addis Ababa, a number of countries said that they were interested to move from only maternal and newborn health into pediatric quality of care, also into pediatric quality of care. And some were interested also to look at quality of care within the adolescent health space. So this is ongoing. It depends on the capacity of the country. The standards are there. And if countries wish to, they can do so.
Thank you very much. Thank you, Anshu. Now I'd like to shift to Nuhu. And Nuhu, if you are still connected, there are a number of questions around community engagement, initiatives. How do you streamline community engagement? What is happening at the country level? Could you please make a comment around what is the approach around community engagement that the network is taking and some of the examples? And I would like to invite everyone to join our community of practice on community engagement that is in the website, because a lot of questions are answered there. Nuhu, over to you.
Thank you very much, Letta. So at country level, what we've tried to do is that we have tried to work with countries around using existing platforms for community engagement in terms of linking that into the network. So, and what that has meant in real terms has been that, for example, countries have used existing mechanisms. So in Ghana, for example, using the community scorecard, in Malawi, the Ombudsman, in Uganda, the village dialogues. And using these platforms, they have been integrated into the dialogue process that's taking place around implementation, so that in Ghana, for example, you do have that members of the community use community scorecards to assess facilities in terms of quality of care and discuss with the facilities on what their own preferences and priorities are. And that is built into improvement actions for the facilities. And it's the same as well in Uganda. I think what the big challenge has been for some of the countries has been how to, on a sustainable way, particularly in continuous engagement with the community and making sure that feedback from the community is continuously imputed into improvement plans, whether it's at facility level, at district level, sometimes at national level. This is not something that occurs normally, even though these structures are there. It's not occurring normally in most countries. So I think one of the outcomes or outputs of the network has been this learning process of how do you bring and integrate and link this into implementation that's taking place.
Thank you, Nuhu. And just to complement, there was a question if we are considering community health workers as part of the community engagement. Just to clarify, community health workers are a service delivery, are a provider. So when we discuss community engagement, is really engaging the users of the services, the community that benefits from the services or where the services are offered, in defining quality as well as in providing the accountability mechanisms to understand that the services provided are really of the quality and meeting the needs of that community. Now, I would like to shift to Ted Babe. Ted Babe, there are a number of questions around scaling up. And I'd like first to ask you or a comment from your side as UNICEF. UNICEF is really embedded at the district level implementation, and you are actively shifting towards scaling up from the initial districts to more. Would you like to make a comment around that? And then I'll open it, the same question of scaling up to all panelists for their views on what are some of the fundamental principles that can support the scaling up, starting from the lessons learned so far from the network countries. Ted Babe, over to you.
Okay, yeah, thank you. Before I respond to that, I just wrote, a response regarding accountability and wanted just to share, small aspect in this line. In Tanzania, for example, they have this mobile app and the program they call Mama Umana, and where clients have the opportunity to provide feedback on their experience of the service. And the feedback or the input, that input is collected and used to have a dialogue between health facility and the clients and the community come together and come into, a consensus. So the health facility gets feedback, and also the community also would better understand what the struggle the health facility is facing. And in that way, actually, in some cases, the community also could be an advocate for the health facility to get, the necessary support. On scaling up, what we have seen is, first of all, when health facilities see the change, let's start even from the team. A small team, maybe the maternity team only, initially gets energized and see value and motivated and starts to apply quality improvement. This expands to the other team, to the antenatal care team, to OPD, to OR, to other parts of the facility, and also to other facilities within the district. So there has been, a small diffusion, and as also more experiences are shared within the district, scale up has been happening across district as well. But one thing is clear, this didn't happen on its own. It requires that, continued technical assistance, not so much, the financial assistance. The government's response also has been really remarkable, leveraging other funding resources to improve some of the quality improvement aspects. What I would say is, in my closing remark, the infrastructure part really requires significant resource. If a health facility does not have a functioning OR, but have large caseload of deliveries, to have that 24 hours, 7 days a week service requires investment in ensuring water sanitation and expanding that service. So That requires, partner engagement, and the UNICEF has been able to raise the resources from multiple sources and to fill that gap. That's why, this continued handholding and continuing support needs to occur until countries have, that reliable financing system and be able to do on their own. So now we have a number of mechanisms. The global, financing mechanism is there. We just need to make sure the investment cases are, well informed by data and address, the prevailing problems. The Global Fund Health System Strengthening is also there. There are, a number of resources, but it requires, pulling this together and making it work for mothers, newborn, and children. Over to you.
Thank you very much, Tedbabe. We have one last minute. So Anshu, one last word around the scaling up and sustainability.
Thanks, Blerta. And indeed, I think this is a crucial issue that we need to address within the network. We have started with piloting and, of course, as highlighted in a number of districts in each country. And it's really time now for us to be able to make sure that these lessons are shared and also implemented in other districts and also in other countries. So I think the report makes two recommendations or looks at two issues. One is around how do we scale up within the country? And the second one is how do we scale up amongst other countries as well? And so we would be delighted if there are other countries that would like to join the network and learn from the expertise, let's say, that we have built up now in these 10 countries in order to be able to implement this also in other countries. And really, this would be South-South learning and an excellent example of how networks can work.
Thank you very much, Anshu. And Olive, may I ask for the next slide, please? So colleagues, thank you for the interest. There are a number of questions that are there. We would like to seek your advice and participation to identify critical topics that we as network must document. Please take the survey. It is, I place it on the chat as well. You can take it from there or here. It is also part of the newsletter that we shared at the end of last month. Visit our website to see it. Let us know what you think. Thank you very much for the participation today. Thank you for lessons learned. And with this, I would like to hand over to Olive Kokoman for the last words. Over to you.
Thank you so much, Berta. Well, just to say, as you said, everything is on the website. We'll also email all the participants with the slides and the recording from today, the survey link, the report link, etc. We are saving all your questions. We're curating them. We're putting them into the community of practice. So if you join that link, you can engage and share more questions, your experiences, your comments. We'll engage with speakers today to respond as well to questions posed. So thank you. Join the website. That's where you can connect with us and link to our monthly updates and our webinar series. And you can sign up for those so we can keep you continuously informed. Thank you. Thank you for all your lovely comments on today's session as well. Look forward to our next moment together. Take care.